Sorry about that. I was on mute. Good afternoon, everybody. I hope you've had a cup of coffee, as have I. My name is Sarah Taysir Ben Sharif, and I'm a health reporter at Politico Europe. Thank you for joining us online for what's sure to be an exciting event hosted by the European Centre for Disease Prevention and Control to mark European Immunization Week. This year's theme focuses on the need for a lifelong approach to vaccination. I'm joined today by a fantastic panel of speakers to look at the state of play on vaccination in Europe, covering what's working and, crucially, the gaps to cover. Over the last few years of the COVID pandemic, the world has seen and learned about vaccine development in real time. The arrival of the COVID vaccines marked a new chapter of the pandemic. But vaccines have perhaps been the victims of their own success, and the pandemic put a spotlight on issues that really have been lurking all along: vaccine disinformation and vaccine hesitancy. We know that vaccines are one of the most effective tools to prevent disease and improve public health. And yet, we've seen a decline in vaccine confidence in many parts of the world. We've got some fresh data on this from the Vaccine Confidence Project. It found, for example, that in France in 2019, 86% of respondents thought that vaccines were important for kids. Now, that figure alone is perhaps cause for concern already, but it's all the more alarming when we see that in 2022, only 75% thought that vaccines were important for children. In Italy, it was 92% in 2019, and it went down to 85% in 2022. And when it comes to perceptions of vaccine safety, the figures aren't always encouraging either. In 2019, a solid 96% of respondents in Finland, for example, said they thought vaccines were safe. And now when we look at 2022, the figure dropped to 88%. So clearly, something's shifted. I hope that today we'll be able to do a few things. First, we'll hear from experts about where Europe stands when it comes to certain vaccine-preventable diseases. Then we'll dive into the ways we talk about vaccines and how we tackle vaccine misinformation. And lastly, we really want to hear from each of you tuned in. Please send us your questions, as we'll have lots of time for them during the event's question and answer periods. We encourage you to use a couple of hashtags. There's hashtag vaccines work, hashtag United in Protection, and hashtag EIW 2023. And in case you want to refer to the event later, just a note that it is being recorded and will be made available afterwards on the ECDC website. Now, without further ado, I'd like to give the floor to our first speaker, Andrea Ammon, the director of the ECDC, for some opening remarks. Andrea, over to you.
Thank you very much, Sarah, for the introduction. And a warm welcome also from my side to this event. It marks the beginning of the European Immunization Week, which draws the attention to vaccination. And vaccines are one of the two medical interventions that really brought infectious diseases down. And vaccines prevent severe disease, they prevent death, they prevent cancer. And you would think people run to get them. It's not the case. Despite the proven safety and effectiveness of vaccines, many EEA member states, as well as countries around the world, have and continue to see cases of vaccine preventable diseases and sometimes even outbreaks. And challenges in the uptake and acceptance of vaccines are reflected in some countries even before the COVID-19 pandemic. And to illustrate in one of the reports that you will hear more later about polio, between 2012 and 2021, approximately 2.4 million children in the EU EEA may not have received the 3-dose vaccine of polio on time. And while the European region has been kept polio-free for 20 years, the virus still is detected periodically in its wild form and also as vaccine-derived strains. only owing to the adequate surveillance and relatively general high vaccination coverage in the population, these sporadic detections led to sustained transmission in the EU or detection of human cases. However, as long as there are still subgroups in the population that are under-vaccinated or not vaccinated at all, there remains a risk that the virus is reintroduced in Europe. And while this is the case for polio, it is also the case for measles. When the vaccine coverage is suboptimal, the virus can find ways, because it's very highly transmissible, to spread into pockets of unprotected population groups. And that can lead to outbreaks that then, as a consequence, can be a burden on the health systems. And so while I have speaking so far now on vaccination for children, we want to highlight that vaccination is an important point for the whole life. So vaccination programs that, of course, focus traditionally on children also address people of all ages, adolescents, adults, pregnant women, people living with chronic diseases, and the elderly. And today we would like to encourage all individuals to consult the national vaccination schedules and to discuss with their doctors to make sure that they do not miss out on any of the recommended doses. And continuous work is necessary to identify these gaps, where they are, in which population groups, especially in hard to reach population groups such as refugees, migrant, asylum seeker, and other underserved populations. So accelerated effort to improve immunization campaigns and promote the vaccine acceptance and uptake are necessary to achieve the high vaccination coverage against vaccine preventable diseases that are necessary to actually prevent those diseases. And we will keep this as a priority in the future to support and strengthen the national routine vaccination programs with the principles of safety, quality, effectiveness of vaccines, as well as timely and equitable access. I wish you a very fruitful exchange now, and hand back to the able hands of Sarah Tessier. Thank you.
Thank you so much, Andrea. We really appreciate your opening remarks. There's a lot for us to chew on there, and certainly we'll address a lot of those issues. Next up, we have Sabrina Bacci. Sabrina leads the ECDC's Vaccine Preventable Diseases and Immunization section, and we'll be hearing from her about the monitoring of vaccine preventable diseases in Europe, looking specifically at measles and poliomyelitis, which Andrea mentioned in her opening remarks. Now I'll hand the floor over to you, Sabrina.
Okay, good afternoon. Yes, thanks. And we are delighted to be here today at ECDC and have the opportunity of the European Immunization 2023 to remind us of the great value of vaccination. Vaccines have been protecting us for more than 200 years, and it's just some of us, it's just they're protecting us from diseases that we haven't seen them, and they are, as the director mentioned, almost forgotten. The year theme of the European Immunization Week for this year is about catching up any missed or postponed vaccine doses and remind us on the importance of timely immunization. And we have seen the value of the vaccines during the COVID pandemic, how important they were in fighting this pandemic, and how really they made a difference in protecting life of the individuals, life of our dears, and really preventing deaths and long hospital stays. In order to protect us, vaccines must be taken on time. And every country in the EU has an immunization schedule. This is organized in the way that it's really responding to when we, at different stages in life, are at most risk for different vaccine preventable diseases, and also takes into consideration how is our immune system works. For most diseases, more than one dose is necessary, and the full schedule, the full doses are also important, not only to protect us as individuals, but also to protect us as the society and those who are around us, our loved ones. And we wanted to bring two examples from two vaccine preventable diseases from some data from our reports that we have published today. So the first one, and is the next slide, it's the example of measles. We have seen in the last year, this is the data that we are releasing today, specifically with this report is the data referring to 2022 and some years before, and we have seen a decrease in the number of cases of measles in the last couple of years. This was probably due to the measures implemented to the pandemic, but at the same time we have seen that already cases start to appear again. And the cases that we see appearing again, and what we have observed in previous years, always in picture. The first important information is that the measles cases that we see are those that are not vaccinated. You see them here in red. It's quite clear. This is the majority of individuals who are getting measles. Another important information that we keep seeing at all times is that those below the age of 1 are those who have the highest risk, the highest incidence in terms of getting the disease. And these are our children that we fail to protect with herd immunity. So they are the ones who are paying the highest burden, because cannot be protected by vaccination, which happens after the first year of life in most cases. Another important finding that we see from the data is that 4 out of 10 adults, of 10 cases are adults. And most of these cases, between 70 and 90%, are not vaccinated. What does this mean? This means that actually measles is not only a childhood disease. We have young adults who are getting this disease. They have been, they are unvaccinated. They haven't got the vaccine on time at all time, and they get the disease. So this is a disease not only of children. Another important element we see is that we have also children between the age of 1 and 4 who get vaccinated. These are children that could be protected and are eligible by the vaccination in countries. But why is this important? The next slide, thank you. This is important because measles is a disease can be serious. It presents with a rash and different symptoms like a type of conjunctivitis and others. But very importantly, it leads to complication in 3 out of 10 cases. And this can be pneumonia, diarrhea, but can also be much more severe, like encephalitis, deafness. And then we also have long-term complication, and you see here a situation of severe encephalitis that actually eventually brings to death. So it is a serious disease, which again, as I said, can be prevented. Another example that we've been looking at recently is the one on polio, and I ask for the next slide. Thank you. And what we see here, it's a map of the EU, which is white. It's not showing anything happening, and this is what has been happening in the EU years. We haven't seen a polio case. So Europe, the EU has been polio free for 20 years now, and this is what we have to look at when we look at the future. This is how we want this map to be in the future, and we have polio vaccine is part of the childhood programs, and it is important that continues to be so. At the same time, we have calculated, and this we have performed an estimation based on published coverage data, and this is the next slide. Thank you. We have been estimating that approximately 2.4 million children who were born between 2012 and 2021 might not have received the third dose of polio vaccination on time. And this is an estimation, but is a reminder that might not all individuals might be reached by vaccination on time, and these individuals sometimes are also clustering in the same geographic areas. So this is a number that when we look at the future, we want to see smaller and smaller in order to protect our populations. When we are thinking about the key actions, and this is the next slide, thank you for, and why is this is polio important? Just to summarize, it's a disease that can be quite severe. It's very infectious. It can lead to paralysis and can lead to permanent disability in a number of cases. There is no cure, and it was a disease very, very frequent in the past. Again, we have forgotten how the people how severely can be affected. But it's it's a disease that can be very severe. The next slide, thank you. When we are thinking about our actions and all the important elements for success of the immunization programs, we as public health authorities have a tool which is surveillance and monitoring of the vaccine preventable diseases, and this is what we need to continue doing in order to document how how vaccine preventable diseases are evolving, and where we should prioritize our forces. The role of the healthcare professionals, doctors, nurses, is a fundamental role in talking to the patients and really recommending to take their immunization when relevant on time. And regulators and immunization experts have a key role and continue to monitor how effective and the effectiveness and safety of vaccines. And an important reflection is that can be a struggle for us parents to make informed decisions and to really make a decision when we have a lot of information. And here again, it's the role of all us as critical stakeholders to provide easily accessible and updated information for the parents to make an informed decision. So to conclude, timely vaccination is important. It's critical. It's about the childhood calendar, but not only. It's also about protecting our adolescents, older people, people suffering with chronic conditions through all their life course. And we, as stakeholders and individuals, must take action in order to prevent what is preventable and promote public health. Thank you.
Thank you so much, Sabrina, for this really interesting presentation. There's a lot of work left to do, clearly. I do have a minute for a question. We're talking about monitoring these diseases, and it sounds a little bit unpleasant, but I do want to talk about sewage water. We've heard more and more about its use during the COVID pandemic to detect variants, and I'm wondering what role can it play in helping us detect the polio virus and helping prevent disease, since we are so close to being globally polio-free?
Thanks. Yes, it's polio is being monitored traditionally, really looking at how the disease is presenting in its clinical form, and this is what we call the acute flaccid paralysis surveillance. So this is about identifying traditionally really those individuals who present with a severe form of polio disease. In the last decades, more and more importance has been gaining what we call a complementary tool, really, to what the clinical information can bring us. It's about and using environmental surveillance to provide additional information. So indeed, this is a complementary tool. It's something that it can be implemented at a different country level, and also there are a number of recommendations from the WHO on how this should be implemented.
Thank you so much, Sabrina, for your answer and for sharing your expertise with us. We really appreciate it. I've got lots of questions, but I want to remind our audience to submit your questions as well, because we do have the opportunity to have an expert panel amongst us. So please do send your questions over on the platform. And with that, I'd like to thank Sabrina for your contribution, and we'll be hearing from you later on during the Q&A, I'm sure. Next up, joining us is Katie Owens. Katie is an Information and Communication Officer at the European Commission's Directorate for Health and Food Safety, also known as DG Santé, and you'll be hearing from her about how to boost measures against vaccine-preventable diseases. So, Katie, virtual microphone over to you.
Thank you very much, Sarah. I hope everybody can hear me, and I'm unmuted and everything is clear. Firstly, allow me to take the opportunity to wish everybody a happy European Immunization Week. It's a really important moment, so a special thanks to ECDC for organizing this conversation today. I think it's really timely and really important. So I think I'd like to start with a very brief introduction to who I am and why I'm here, and to show you a little bit how vaccination has impacted my career over the past few years. I joined DG Santé in September 2018, and already then vaccination was very much on the agenda. Everything was being prepared in order for a global vaccination summit that took place in 2019. So from my very first day, I was involved in work on vaccination. And as everybody here, my life was completely affected by the COVID-19 pandemic and the response. So that's a little bit how I am involved in this whole discussion. But if we can go to the next slide, please. I thought it would be important to start with a short introduction on the political mandate. Why is the European Commission talking about vaccination? Well, as you may already know, vaccination is a competence of national authorities, but the European Commission works to support EU countries to work with the member states to coordinate policies and programs. Again, if we look at the COVID-19 pandemic, we can see just how important this is. We know that diseases do not respect borders, and it's really important that everybody comes together and works together. So in 2018, shortly after the huge measles epidemic that swept across Europe, there was a council recommendation on strengthening cooperation against vaccine-preventable diseases. This is essentially the Bible that we work with here. I think what's quite important is to note the change in rhetoric when this recommendation came out. There seemed to be a shift from the message vaccines work, this one-way communication telling people that vaccines work, they should accept it and just go ahead, into something a little bit broader, where we were focusing more on understanding, on communicating and monitoring. I think the previous speaker already had some of these words on her conclusion slide, so I'm glad to see that we're all coherent. Then when the new European Commission came into place, the new college with Commissioner Stella Kyriakides, the European Commissioner for Health and Food Safety, vaccination was once again put as a really important topic in the mission letter that was delivered to her by President Ursula von der Leyen. And I have put the quote up here on the slide. So the importance here in prioritizing communication on vaccination, explaining the benefits and combating the myths, misconceptions and skepticism that surround the issue. Again, my point with this is to emphasize not only why I'll be focusing a lot on the communication aspects around vaccination, but also on the fact that none of this is new. Many of us saw an explosion of myths, of misinformation during the COVID-19 pandemic, but I think it's really important that we weren't starting from scratch and that this is something that work has already been done and some foundations were already laid. If we go to the next slide, already mentioned by the moderator, the State of Vaccine Confidence in the EU report is something that we've been publishing for the past few years. And I thought it was interesting to have a quick snapshot at how vaccine confidence has changed throughout the pandemic. As you can see on the slide, the numbers in blue are from 2020, the numbers in pink are from 2022. You can see that there has been a slight decrease in the levels from 2020. Now, obviously, we're all trying to understand what the reasons behind this. Obviously, the pandemic had a huge impact. On the one hand, vaccination became very visible. You could really see the benefits of vaccination, the way that it saved lives. But on the other hand, it was put into the media, into the public sphere. There were lots of discussions. We have the term the infodemic coined by the WHO. This idea that there's so much information out there that it's sometimes hard to determine what's true and what's false. And I think this affects people's confidence. Now, I think it's also important to say that confidence doesn't necessarily mean whether people get vaccinated or not. When people are asked whether they believe these statements, it's a click on a screen. How they actually go through with this in the doctor's surgery is something that's different. And I also think it's important that we make a difference between vaccine confidence and the sort of structural barriers to vaccination, which are equally important. As you can see, the numbers are still relatively high. Although we've had this decrease, the numbers are over 75 for all the categories that we asked. And these numbers are more or less in line with what we had in 2018. I think it's also an important note that there is a huge difference between vaccine types and also between and within countries. We talk very often about these pockets of unvaccinated people, and I think the confidence results also link into this. So we have these pockets where vaccine confidence might be lower. We've often talked about the need to really go local, understand, to listen to people, and to try and find out why this is. Sometimes an EU top-down communication exercise is not going to reach these most vulnerable groups, and I think we always need to keep that in mind. Another interesting point from this vaccine confidence report that we published showed this widening gap in between the age groups. Younger ages showing a drop in confidence, something that's quite concerning and something that we're very closely keeping an eye on. And we'll explain a little bit of some of the actions that we've taken a bit later. So if we go to the next slide, please. Here I give you an overview of some of the actions that the European Commission has taken to boost vaccine confidence. These are all listed in a roadmap linked to the Council recommendation that I mentioned. And I think some of them I'd like to highlight. So firstly, we have the joint action on vaccination. This was very important to bring member states together, to work with the EU countries. As I said, vaccination is a national competence. There's nothing we can do unless we have the countries on board. I've already mentioned the monitoring that we've been doing through the vaccine confidence reports and also the various Eurobarometer surveys that were published throughout the pandemic. One of the tools that we're very, very proud of, we work hand in hand with the ECDC and EMA on, is the European Vaccination Information Portal. If you're not familiar with it, I'd encourage you to look it up and to see what's on there. This is a really useful tool for objective and up-to-date evidence and scientific-based information. We also have a coalition for vaccination that was established under the Council recommendation. where European associations of healthcare professionals and student associations come together to work against addressing the myths and raising the awareness of the benefits of vaccination. And last but not least, there has been a massive effort to address the mis and disinformation that's been circulating. This has not only been done through policy measures, such as the strengthened European Code of Practice, where we work with social media providers, but also through more informal channels. The Network Against Disinformation, which publishes an internal weekly newsletter of emerging false narratives, giving a bit of context and ways that these can be addressed. And I think this is a really, really important achievement that was developed during the pandemic and is going to continue as time goes on. If we go to the next slide, please. I'd like to briefly mention the Vaccine Misinformation Counter Initiative. This is an action under the EU for Health programme, where we are working to address these myths as outlined in the mission letter. We're very convinced that people need to have the information in order to make informed decisions, to make the decisions that work for them. We're not telling people they have to get vaccinated, as I said at the beginning, but empowering people and giving people the tools so they can make these decisions. And here we've published a few new sets of material this week. We have a teacher training module, which has been published for primary and secondary school teachers. We're trying to encourage these discussions to happen earlier, to involve young people in the decisions that they are ultimately going to be faced with. And we've also published the first 2 volumes of a series of cartoons for young people. So again, trying to reach these young people that we've seen as somewhat lacking the confidence in vaccines in a way that's maybe more familiar, more relatable to them, and encouraging them to have conversations and to talk with their teachers, with their parents about vaccination. And if we go to the last slide, please. This is our United in Protection communication campaign that we've been running since October last year. We have 4 strands of material on measles, HPV, seasonal influenza, and COVID-19. So you'll see we're going across the whole board on lifelong vaccination. One of the sets of data published this week emphasizes that over 1 million children have missed out on all or some of their vaccinations in the EU region since the start of the pandemic. So clearly, routine childhood immunization is somewhere that we need to pay attention to. But we're also talking about the most vulnerable when it comes to topics like seasonal influenza and COVID-19. And we also want to reach out to teens with issues such as meningitis and HPV very much on the agenda. So this whole across the lifeline approach is central to what we're doing. We've provided editable toolkits, suggested messaging, posters to nudge people to have conversations when in the place that they can have these trusted conversations, and various social media assets. So please do join us, make use of the material and our hashtag United in Protection. And at the very last slide, because I know I'm coming to the end of the time, just to say what's next at the European Commission. So we will have a meeting this Friday with the member states as part of the European Immunization Week activities. We have EU finance projects, again, also looking at physical obstacles as well as just the hesitancy side of things. And under Europe's Beating Cancer Plan, there will be a Commission proposal on for a Council recommendation on vaccine preventable cancers later this year. So something for everybody to keep an eye on.
Thank you very much, Katie. I know we're coming up to the next presentation, but I did want to slide one little question. I'm glad you mentioned the work on vaccine preventable cancers. And as I understand, those recommendations from the Commission are expected sometime after the summer. I'm just wondering if you could give us a little bit of intel on what exactly we can expect and when exactly we can expect it.
So the call for proposals has been published, and there's already some information there giving an indication of where the proposal is going to go. So the idea of addressing barriers, looking at misinformation, the whole spectrum, working with member states, not starting from scratch and using some of the material that's already there. In terms of timing, I'm afraid it's very difficult to say. Everything depends on political timetables and when it gets put on the agenda. It's still very much on schedule for this year. And we will obviously keep you updated, keep looking at the EU Health Twitter account, and we will announce things as they become clearer.
I'm sure there's a lot of moving parts. Thank you so much for your presentation and for all of your insights. We really appreciate it. Next up, we will be joined by Georgi Genov. Georgi is the head of Pharmacovigilance Office at the European Medicines Agency, and he'll be sharing with us some key points about, very important, why we should trust vaccines. So, Georgi, take it away.
Sarah, thank you very much. I hope you can hear me well.
Great. All good.
Great. Good afternoon. I work at the European Medicines Agency, which is responsible for authorization and supervision of medicines in the EU, and that includes vaccines. And as Sarah said, I had the Pharmacovigilance Office, and we are tasked with monitoring the safety of all medicines, including vaccines, and also coordination of related activities across the agency, but also across member states. And I'm really delighted to have the opportunity to participate in this important event. Great to see more and more awareness about the importance of trust underpinning health decisions. The critical role of vaccine has been highlighted in previous talks. The WHO estimated in 2019 that vaccines save between 4 and 5 million lives every year. And later on, it was estimated that 20 million lives were saved during the first 12 months of COVID-19 vaccine rollout. But what good will our vaccines be if not enough people will take them? In some cases, hesitation is due to doubts about safety. So moving on to the next slide, let me start with a few high-level points as to why we can be reassured that authorized vaccines are safe. It was also said that we've been using vaccines to protect against infectious diseases for over a century, and actually the first world's vaccine was devised over 2 centuries ago. With this extensive experience, we have learned how to make vaccines better and safer. All vaccines have to be thoroughly tested before they can be approved, and as long as a vaccine is being used in the EU, it is also continuously monitored by vaccine manufacturers, but also by EU regulators for any rare side effects that might emerge. A strong and efficient EU pharmacovigilance or safety monitoring system is in place. Safety reports from the EU, but also the rest of the world, are continuously collected in a centralized database, and we monitor and analyze those reports on a continuous basis. Importantly, trust and transparency have always been core to our work at the European Medicines Agency, or for short, the EMA, and public health is, of course, our top priority. So moving on to the next slide, let's see, when is safety monitored? All medicines, including vaccines, have benefits and risks. Safety is studied from the development stage, so from the very start, up until use in real life. At the time of approval, evidence comes mainly from controlled randomized clinical trials where scientists measure and compare data on volunteers who received the vaccine, which is being studied, or those who received a placebo. So vaccines are approved only after thorough evaluation and only if meeting EMA's scientific standards for safety, efficacy, and quality. The safety of vaccine must always be well established before approval. Moving into post-approval phase, vaccines will be used in real condition by far larger population. People do report suspected side effects to their doctor, national authority, or the vaccine manufacturer. These reports are collected in Eurovigilance, and this is the EU database of suspected side effects. EMA monitors Eurovigilance continuously to identify any unusual patterns. Reports of suspected side effects alone are very rarely enough to conclude on a safety of a vaccine. So we always look at all available data, and that includes data from large clinical trials, medical literature, safety studies, and information from other regulators worldwide. If we move on to the next slide, let's turn our attention as to who does the safety monitoring. The EU has a comprehensive safety monitoring and risk management system, also known as the EU pharmacovigilance system, with clear responsibilities for vaccine manufacturers and regulators, and where patients and healthcare professionals play an important role reporting suspected adverse reactions, but also contributing to our decision making. As regulators, however, we do not rely only on safety monitoring by vaccine manufacturers. In addition to review and scrutiny of companies' periodic safety reports, which is a legal obligation, we can commission independent studies, and we collect and closely monitor all new safety information arising for new or potentially changing safety issues. And if detected, such issues will be rapidly assessed by our safety committee, the PRAC. PRAC stands for Pharmacovigilance Risk Assessment Committee. And this committee is an independent committee composed by experts in medicine safety from regulatory authorities in member states, plus scientific experts and representatives of patient and healthcare professionals. And these are nominated by the European Commission. And that links to the previous statement that patient and healthcare professionals, apart from reporting, also contribute to decision making. If we move on to the next slide, let's focus on how we review emerging safety data. EU regulators continuously review all reports to determine if there is any possible link to a vaccine. Since millions of people may be vaccinated in a short period of time, and we've seen that especially with COVID vaccines, many of those reports, many of those patients, of those vaccinated might develop illnesses for other reasons and in close proximity to the vaccination. If such occur just after vaccination, they may be reported as suspected adverse reactions to the vaccine when the association was just due to a chance. We use established analysis techniques to assess whether a side effect is likely to be caused by the vaccine, and that is not always straightforward. Statistical methods are used to identify outliers and patterns of suspected side effects. We use also observed to expected analysis, especially for vaccines. And this is noting that very rare serious side effects could be caused by a vaccine, but also by the infectious agent or any other health conditions. We also do, of course, perform intensive clinical review. No medicine is 100% safe, and that goes for vaccines, and they do have side effects. However, the majority are mild and transient. If an analysis concludes that a new side effect is caused by a vaccine, it is included in the package leaflet, and if the risks outweigh the benefit, we as regulators could remove the vaccine from the market. So to summarize, let's move to the next slide. Vaccination is important to prevent people getting sick, and it saves lives. A strong EU pharmacovigilance system is in place, and safety is our priority. Very rare side effects, some serious, might be identified and will be detected quickly, assessed promptly, and acted upon, and that will be supported by continuous transparency and communication to the public. Vaccine safety will be stronger with your participation. We really appreciate your efforts, and please continue to report suspected side effects. So this concludes my presentation. I look forward to hearing from you. How can we help further to build trust to support vaccine rollout across the EU? Thank you very much.
Thank you so much, Georgi, for your presentation and for your expertise. This brings us to the first question and answer period of the event. A reminder to our audience to please send us your questions on the platform. And to get us started, I actually just want to start with a question to you, Georgi, since you're on with us already. You mentioned that the EMA works with other medicines regulators around the world, and that's part of the safety monitoring practice for any medicine, vaccine, etc. And I'm curious to know, for the really, really rare side effects that may occur only very, very rarely, how exactly do you communicate with the other regulators so that you have a sufficient body of data to perhaps trigger a safety signal about it?
Yeah, no, thanks, Sarah. I hope you can hear me.
Yes.
Okay, great. No, it's a very good question. We have established collaboration with many regulators around the globe, and this is under confidentiality agreements that we sign. We do exchange data, we do exchange assessment, we exchange expertise, and as you say, we have access to worldwide data. Maybe I'll step back. I mentioned our spontaneous reporting system, Vigilance. So this system already contains all reports from patients and healthcare professionals, so serious and non-serious, but it also contains serious reports worldwide. So we would already have at EU level access to reports that come from around the world when it comes to serious events for all medicines, and that includes vaccines. Now, with other regulators, we have regular calls. So on the pharmacovigilance side, we have monthly calls where we discuss emerging safety issues. During the pandemic, but the pandemic was interestingly was a real booster for international collaboration. You might have heard of the ICMRA, which is the International Coalition of Medicines Regulators. So there are a number of additional initiatives set up specifically for COVID-19 vaccine safety monitoring. We had the pharmacovigilance network cluster, where on a very regular basis, many regulators will discuss over time if there's any emergent issues, what is data in their jurisdiction shows, and what is their assessment of this potential safety issue. So it's incredibly helpful. ICMRA also looked, and I'll stop that, I don't want to take too much time, but ICMRA also established a number of initiatives with regards to collecting data on internet, doing studies internationally. So we had that with regards to pregnancy, a number of other initiatives using of real world evidence. So just if I wrap it up, we do have established framework, and we exchange very regularly, and COVID has been an additional booster, I would say, for really regulators to work together, because it has been a really global effort. I'll stop here.
Thank you very much, Georgi. It's great that you bring in the question on real-world evidence, because that segs into the next question I have. So this question is addressed to Sabrina at the ECDC, but anyone else is free to jump in afterwards. The question reads, the benefits of real-world evidence for assessing medicines, including vaccines, has been recognized by the EMA through Darwin EU and in the EHDS proposal. How does the ECDC intend to take the entire body of evidence, including real-world evidence, into account when assessing the effectiveness and safety of influenza vaccines as part of the ongoing systematic review?
Yes, can you hear? I think
Absolutely.
so. Thanks. And indeed, this is the pandemic has really shown the importance of the real world evidence. But actually, this is something that we knew from before, and something we had been investing for a number of years. And more specifically, one of the important piece of work that I think is worth to mention today is establish collaborations with EMA under the what we call the vaccine monitoring platform. So this is it's a new platform we have established with EMA that brings together public health experts and auto regulators for really looking at effectiveness data, and not only also safety, as this becomes available, and really using all the evidence to make to be informed as we move forward. And this is really the pandemic has really shown the importance of really having engaging with more and more stakeholders, and the translation of this in the work of the vaccine monitoring platform is something that we look forward also as in the years to come. And I don't know if maybe EMA would like to add on the safety and the studies that are being conducted on under this platform.
No, Sabrina, I mean, I think you described it very well. We work together. I think it's a really, really important initiative, and has been, as you said, on in development for a while. And I think that's one of the positives of COVID, as in many other aspects in terms of research and setting up platforms that has been has proven what these platforms do, and especially when we have a critical situation. So. A great initiative, full support from our side.
Thank you both. Georgi, while I have you, we have a question from David Elliman addressed to you. David is asking, what proportion of serious adverse reactions are reported, do you think? And then another follow-up from elsewhere, severe adverse effects are rare, but they still exist. What is the EMA's role when such a case is confirmed?
Okay, thank you. So in terms of proportion of serious, it depends. It really depends which data set we'll be talking about. For spontaneous reports, I think I'll take only European data because in Europe we collect serious and non-serious. Outside of the world, as I said, is only serious. So at European level, and I'll look into the, let's say the most recent data we've looked at is COVID-19 vaccines. And the vast majority, that applies to other medicines, but the vast majority of the reports will be non-serious. So I think, roughly around 2/3 of the reports will be non-serious. Now, an additional, just to put that a little bit into context, an additional kind of development that we've seen with patient and healthcare professional reports for COVID was that we've seen a lot of consumer reports. So these are non-healthcare professional reports. So that might have driven a little bit higher proportion of non-serious reports compared to other vaccines or other medicines. But broadly speaking, the vast majority would be non-serious effects. And when it comes to rare side effects, obviously, these are all the vaccines are nowadays studied in quite large. The population studied in clinical trial is quite large. I mean, for COVID vaccines, we had a close to 30,000, which is much higher than other areas. Where I'm going is that the rare side effects will more likely be detected in the post-authorization phase. So what we can do as regulators is detect those very quickly, as we can, and we monitor very closely all emerging data. Then as soon as the causal association is confirmed, and that is not always, as I said, a straightforward process. One of the reasons is that a lot of those, the vast majority of severe rare side effects could also be caused either by the infectious agent or by other health conditions. So the question then is, which one of those caused the effect, the rare side effect, the vaccine, the infection, or or another health condition? But let's say we've established causal association, so that means it is at least a reasonable possibility that the vaccine has caused that side effect. Then we would introduce that to the label. We'll immediately communicate to the public. So the label is the product information, and depending on the side effect, if that requires consideration of the benefit risk, there's also, apart from labeling changes, there could be a suspension of the vaccines all the way to restriction of use, withdrawing it from the European market, if the benefit risk is not positive anymore. So, Sarah, sorry if that was too long of an answer. Just stop me if I go too much into the details.
No, it's great to see people so passionate about the work they do. So thank you for your detailed answer. So we've heard about how the EMA monitors for side effects and ensures safety of vaccines, but despite this, there is a fair bit of misinformation circulating out there. So Katie, the next question is for you. We often talk about social media being a vehicle for vaccine misinformation, but the question we have is, can social media platforms help in eliminating misinformation about health-related matters? And part two, is the Commission doing something on this matter?
Yeah, I think we have to see social media as both sides, the two sides of the same coin, let's say. On the one hand, social media is an incredibly important and powerful tool to be able to share information, to get this information out there, factual information, science-based information. And I think the social media platforms did a lot during the COVID-19 pandemic, working with agencies such as ECDC or EMA, also working with national authorities to make sure that these facts, this up-to-the-minute evidence was coming out and getting out to the people where they wanted to find it. So I don't think we should vilify social media platforms completely. On the other hand, it is clear that's where there is a lot of this misinformation out there. And I think it's really important that both the social media platforms and regulators take this into account. So on the Commission side, in what's being done, we, on one hand, on the sort of more soft side, are monitoring everyday social media exchanges, data, let's say, around the terms linked to vaccination. We're spotting any false narratives, we're spotting any trends, and we're working internally to use proactive communication to address some of these gaps or where the misunderstandings might come from. And in addition, there is the code of conduct that the social media platforms have signed, so a voluntary system they have signed up to and are taking various different measures. We saw much more during the COVID-19 pandemic, where harmful material was taken down. I think it's very, very important that we allow freedom of speech. It's a very fine line. We have to make sure that these rules are very clear and in place. Somebody's opinion is not necessarily one that we don't agree with. We have to be really careful how we do this. And I think the platforms have done a lot. There's still more that can be done. On a personal level, I'm concerned to see some of that being reversed now that the COVID pandemic is moving on. And we're seeing a lot more of this material, this false information circulating again without being countered. So as a plea, I would say to people out there, if you do spot misinformation on your channels, please report it. You don't necessarily need to have a fight on the social media platform itself. Sometimes this is counterproductive, but there is often a way within the platforms themselves to flag this and to make sure that that's then looked at by the social media platforms and they will take the necessary steps.
Thank you so much, Katie. Yeah, there's clearly a lot of work to be done to combat the ongoing circulation of vaccine misinformation. And we, as Sabrina, you mentioned in your presentation, we do see that when there are measles outbreaks, the vast majority of people who do have measles are people who have not been vaccinated against it. So this next question is for you, Sabrina. As we said, we periodically see outbreaks of measles, and you've shown us the cases we see now in the EU, but what is the state of measles control in the EU, and how are countries doing towards the elimination goal from the WHO?
Thanks, Sarah. Yes, so the measles, I mean, if we look at the last 20 years, we have been seeing a periodic larger outbreaks of measles, and this is what we expect by the nature of the disease. But we also know that in the last decade and so countries have done tremendous efforts in scaling up these programs. And actually, we can say that in a number of countries in the EU, really measles can be considered eliminated. However, we would like to see more countries to have not to see measles cases, and or at least not to have transmission of measles cases. And for this reason, it is key to have high vaccine coverage in the countries with 2 doses of diseases. We know that this is measles is a very infectious disease. 2 doses are necessary really to ensure full protection of individual level, but also of the population. What is key really in this fight against measles is for the countries to have a high quality surveillance. As seen, this is what is feeding our information, how things are going in the field. We need good systems that are able to capture the clinical information, but also an integration with the laboratory surveillance. So this is key to understand how things are going. Then, of course, the other key element is to have this high vaccination coverage, but also to have a possibility at country level to respond to outbreaks quickly. So this is also our tool to respond quickly and then to control these outbreaks with the appropriate interventions.
Thank you, Sabrina. A quick follow-up on that. When we talk about surveillance, obviously we need to be making diagnoses of measles in order to know what is happening out there. I'm just wondering, are there any concerns about underreporting due to difficulty accessing healthcare systems, and professionals are under a tremendous amount of pressure, they're catching up on backlogs? I'm just wondering, are there concerns about underreporting, and are the how do we know that the figures represent the full picture of what's happening out there with regards to measles?
Underreporting is a theoretical aspect at all times when we are really thinking about how we monitor these diseases. Generally speaking, we can say that the surveillance systems for measles in the countries are quite strong. It is of course possible that some cases are missed and do not reach the full, let's say, reporting mechanism. But in general, if we compare it to other diseases, the investment that have been put in this type of surveillance, and I'm talking about local level, regional level, national level, and international level, has been immense. And also the capacity that has been put by the countries in really integrating the systems and having a strong laboratory component, also to differentiate measles with rubella is important. However, there is always the possibility to do more and also raise awareness, keep the awareness among clinicians of a disease that maybe young clinicians have never seen.
Yeah, absolutely. I remember in medical school learning about these diseases and thinking, oh, I don't know if I'm ever going to see that. I have seen measles, but many of the other diseases, you don't recognize them if you don't see them.
Exactly.
Yeah. I have a question here from Joy Wilkinson. This is addressed to you, Georgi. So if it's possible to expand upon this, what are the causes for the timing differences between vaccine and drug approvals between the FDA and the EMA?
Well, it's maybe it is a difficult question for me to address. We do have at times different regulatory approval systems could be used for COVID-19 vaccines. In US, they use emergency use authorization, which is slightly different. Well, it is different than the authorization path in EU. However, I don't think there were, especially for COVID-19 vaccines, I wouldn't say there were any notable differences in terms of the speed of the approval. What we have seen is certainly, I mean, unprecedented. I know we use as a buzzword when it comes to COVID, but a lot of things were unprecedented with COVID through. I mean, speed of the development of these vaccines, the speed of the approval of these vaccines, the speed of the exchange of information. All the regulatory system working in really accelerated time frame, and yet being able to provide robust authorization, robust assessment of safety issues, robust and quick communication to the public. I think it's a lot to learn from it. That's one part to focus on. Of course, if there is ways as well to for critical medicines and vaccines to accelerate approval. And I think we've done that. We've shown that we can do that at European level for COVID with these rolling reviews that we had. I don't know if people are aware, but we would start looking at pieces of the information. So whatever, because we review the data that the companies will provide to us. Without that data, we cannot progress. So we need to see their dossiers. And the approach we've taken is to look at the part of the dossier that is already available, start evaluating it and building the puzzle, as opposed to waiting to all the pieces put together and then start our review. And I think we've done fantastically well in terms of timeframes. Would there be differences across regulators? Of course, but we also do use slightly different legal systems. So there are implications that come from that as well. Over.
Thank you so much, Georgi. I think we're coming up on our time for the Q&A, but I do have one last question for you, Katie. You mentioned that there are vaccines, of course, to prevent cancer. And I'm wondering, do people's attitudes towards vaccine change if it's a vaccine to prevent cancer versus if it's a vaccine to prevent an infection that doesn't lead to cancer? And is this sort of the renaissance for vaccines where people might have a renewed interest and a renewed faith in vaccination's potential as a public health tool?
I think you make a very valid point, yeah, and indeed that's one of the things that we saw from the confidence reports, is that it is different depending on the vaccine. And when you talk about vaccines that prevent cancer, the most obvious is the HPV one, which when it was first introduced, there were some concerns. It wasn't hailed right at the beginning as a perfect solution. I think we have to use all the momentum we can. Obviously, with the EU cancer plan, there's a lot of political attention on cancer. So this link, I think it's a very clear message, especially to adults who can understand that this is a great benefit. If there's any way we can prevent cancer, this is something that we need to do. We've seen statistics that 1 in 3 people will be affected by cancer at some time in their lifetime. I think everybody knows somebody. It's a simple measure that we can all take to protect ourselves and our loved ones. So I think this is really important. And indeed, let's use the momentum, but let's not shift all the attention in one direction, which is, I think, maybe somewhat what happened during the pandemic. As Georgi said, unprecedented times, and clearly attention was focused there. But that's a little bit what we're talking about during this immunization week, this lifelong vaccination. Let's not focus just on one, but remember that there are these different stages at life and these different vaccines that can protect people against different diseases in different contexts.
Thank you very much, Katie, for your answer. And this wraps up our first Q&A. So a big thank you to all of our speakers and a big thank you to all of our audience members for your great questions. A reminder that we have a second Q&A after our next 3 speakers. So please send us some more questions. We're very keen to get them and to give you the chance to ask them. So with that said, we will now be joined by Brett Craig. Brett is a technical officer in the Vaccine Preventable Diseases and Immunization Program in the WHO's Regional Office for Europe, and he's specifically looking at vaccine acceptance and demand. Hi, Brett.
Hello.
The floor is yours now.
Great. Thank you. Hello, everyone. Happy to be with you. Happy to share with you just some materials and basically insights that we've gained working with a lot of health workers and communities across the European region with regards to concerns about vaccination and communicating about vaccines and vaccination, both in clinical settings to patients and to caregivers, as well as outside of clinical settings in communities, in different venues, through educational events, through other simple conversations that others want to have, whether they're in a position of influence or whether they simply want to talk to their family members about vaccines and vaccination and how can they have effective conversations. And so we have conducted a lot of trainings with healthcare workers across the region and also conducted trainings with community outreach workers, other volunteers, both during the COVID-19 vaccine rollout, but also now with a shift towards a focus again on routine immunization and building confidence in vaccination in communities. So I'm going to talk to you a little bit about just some of the evidence-based communication strategies that both whether you're a medical worker or whether you're just want to be an advocate for vaccination, how can you have these effective conversations? And I'll just go over some basic principles and why these work, why they're effective in conversations and what to look out for. So if you go to the next slide, please. So basically, these are some of the elements that I want to discuss just briefly with you today about having effective conversations about vaccination. I'll go through each one of these in detail and explain kind of the rationale behind them and what you can accomplish with each of these elements of an effective conversation. So if you can go to the next slide. The first one is called announce, and basically the way we start a conversation about vaccination or the way we initiate it is actually very important. Too often we kind of result with a hesitant or tentative kind of introduction to the topic because we aren't sure perhaps, or we know that someone maybe isn't particularly confident in vaccination or has a position that makes them a little bit adversarial or at least uncertain about vaccines. And so we start kind of softly asking a question like, what do you think about vaccination? Or what are your concerns? And this actually kind of sets the stage or normalizes an uncertain or a lack of confidence in vaccination. And what we want to do is actually promote confidence in vaccines as the norm. And so begin your conversation with a positive announcement that vaccination will happen, or that it's available, or that it is recommended, or that it is completely expected that someone would want to go and receive the vaccine for themselves or for their child. So simple statements like your child is due for a 1-year routine, or it's time to get your flu vaccine, or great news, I heard that they're having the vaccines available here, okay, or I just got my vaccine. These are proactive statements that, again, set vaccination acceptance as the norm. Be confident in that statement. Avoid asking questions about, that normalize essentially people's concerns or hesitance. And also, it's much more of a firm or proactive approach. It assumes that you would expect others to be also confident or accepting of vaccines, and it signals the confidence that you have as well. So in speaking about vaccination, start conversations with presumptive statements, those that normalize acceptance of vaccination. Next slide, please. Having said that, that's how you start the conversation, but it's equally important to then listen with empathy. It's not to push vaccination acceptance as the only acceptable norm in that sense, right? It's to actually listen and try to understand where people are coming from. And this is a good follow-up, because when you start a conversation with confidence, with a statement that expects vaccination acceptance, then you can actually see how someone reacts. And depending on their reaction, their response, you can see kind of where they fall on what's called the vaccine acceptance continuum. You can see that on the slide there. People in any given society range in terms of their level of acceptance to their level of uncertainty or concerns that they might have, to outright refusal. And people fall in various places on this continuum. And it's important to remember that people have different reasons for their concerns. They're not all necessarily the same or have the same reservations or concerns if they're not ready to accept vaccination. And that's why not only is it important to listen and understand where they might fall in the continuum, but listen carefully to understand their individual or specific concerns. And then how is it that I need to respond? What is this person's position? And where can we go from here in a conversation? Next slide. What's important is that we maintain a level of respect and trust during this conversation. So we can be very confident in our position to advocate for vaccination and the benefits of it. But at the same time, we want to maintain respect between the person we're talking to, that they do have an opinion, and that we aren't trying to force, bully, intimidate them out of their opinion, but actually we want to have an open and understanding discussion with them. This will allow us to share our opinions, our knowledge in a much more effective way. And so use open-ended questions to understand what their concern might be. You don't take anything at face value. Sometimes people might say something initially, but asking open-ended questions to dig a little bit deeper. Could you tell me more about that? What makes you feel that way? Have you had experiences with this, etc.? Allow them to explain more about their side so that you can understand it even better. That way, then you can enter a conversation or a point in the conversation where you can begin to share back and forth. So ask permission if you can discuss this. Is it all right with you if we talk about this? Is it okay if I ask some questions so I can understand your point of view better? All right. Next slide, please. What's important before we share what we know is that we acknowledge concerns, at least show some empathy, show some understanding. So this is called reflective listening. We listen, we understand. After we ask additional questions to make sure we're understanding, we acknowledge their concerns. We say, okay, I see why you might feel that way. I understand that it can be concerning to you, what you have based on what you have heard. Okay. And we can also take this opportunity to make sure we understand correctly. It seems like you are concerned about this because you've had this particular experience. Is that correct? Is it true that is it my understanding correct that you have had a bad experience with vaccination in the past, and that's why you're concerned about having your child taken for the next dose in the routine immunization schedule? Okay, so acknowledge concerns, show that what they are saying, or maybe what they're concerned about, isn't a reason for you to argue. It's not a reason to be critical, but it's actually a way to show that, okay, I understand why you feel that way. And that opens the door a bit more for them being more receptive to what you have to share. So next slide, please. All of that kind of relationship building and coming to an understanding opens the doorway to a much more open conversation in which the other person you're talking to is going to be much more willing to listen to the information you have to share. It's a general rule in communication that people are much more willing to listen to you once they have felt that you have listened to them. And so using these techniques up until this point is very important. That way, when you do share some knowledge with permission, can I share with you some information that I know about this particular concern that you have? Then they're much more willing to accept your information. They're willing to listen. They feel that at least you have understood them. So what you are sharing is directly related to their concerns. Be sure to share information that is relevant, not just what we call a data dump, citing every possible reason why they should vaccinate. That is less persuasive. It's less applicable for people who have concerns. Tailor your evidence sharing to their specific concerns or beliefs that they've shared with you, so that they feel like it is actually tailored to them and it's related, it's relevant to what they are concerned about. So keep that evidence sharing specific to what the concerns expressed are about. Explain it in plain language. Make sure that it's understandable, and talk openly about risks and benefits. In particular, we don't have to hide information. The evidence is strong of the benefits of vaccination. There are, of course, always some risks, and in a conversation about vaccines, always remember to include not only the benefits of vaccination and the risks of vaccination, but actually the risks of the disease that they are preventing. And that is something that is often left out of a vaccine conversation, unfortunately. Many times people focus so much on talking about vaccines that they forget to talk about why we are vaccinating in the first place. And that is because the risks of infection are much greater. And that needs to be brought into that conversation always when we share information about safety and effectiveness of vaccination. Next slide. Don't shy away from giving your strong recommendation. Now, especially during COVID-19 vaccine rollout, we talked to a lot of people who felt that they resisted having conversations about vaccination because they felt like either they didn't have all the answers or they felt that they couldn't confidently make a recommendation based on the little knowledge that they had. And what's important is that whether you're a health worker or not, you can express confidence in vaccination and in specific vaccines. If you're not a medical professional and you don't want to, or if people have questions that you can't answer about not only the vaccines, but actually about their health conditions, about what they've heard about contraindications, etc., then always you can express confidence and recommendation of vaccination, but also be sure to discuss this with your healthcare provider, because you can, again, take that opportunity to share why you think the vaccines are so important. And that if someone needs further information, that you can direct them to get that type of information. Maybe if you can refer them to particular sources that you're aware of on those topics, that would also be very helpful. Also, sharing your personal experience of family members, why you feel that it's important to get vaccinated, is always very important as well. So take advantage of that. Everyone can be influential. Many people shy away from what they consider to be sensitive topics. Unfortunately, vaccination can sometimes appear that way. But again, what creates a norm, a societal norm of acceptance of vaccination, is having people speaking confidently and openly about it, about their experience, and making that recommendation for others. And if you feel like you want to have more information to be able to more confidently recommend it to others, then I encourage you to get that information for yourself as well. And then next slide, please. And then lastly, remember that regardless of how the conversation goes, you want to keep the relationship open, maintain some level of trust with this person, because generally no single conversation is going to be the make or break situation, but rather it's going to be an opportunity to help move people closer to acceptance. Even if they move only a small amount towards acceptance, that's effective communication in that sense. And some people still might have lots of concerns and hesitation. You might be able to say to them, I see that you're still concerned. That's okay. I encourage you to continue thinking about this, continue looking at this information. I'm happy to talk with you more about it, but make sure you're avoiding judgment, make sure you're avoiding criticism, and maintain that level of trust and openness and willingness to have further discussion about this topic. The interesting thing about trust is that it's not just about expertise, but it has a lot to do with what's called trustworthiness or character, meaning that you care about the person's well-being with whom you are speaking. And that's how people judge your trust or your credibility. And so when you talk to someone in this way, you're not only promoting vaccination, but you're promoting it as a thing that is going to be beneficial for the person you're talking to. And when they at least feel that you're talking to them in this way because it's for their own good, then that makes people more willing to listen and more open to considering what you have to say. So it's really important in this way to secure trust. And then next slide, please. Lastly, just some overall conversation considerations. Remember to be compassionate, show empathy, show that you're listening and that you actually are concerned for the well-being, that you're not just pushing an opinion that you have, that you're actually talking about vaccination because you know that it's a benefit for others and you want to see them benefit from it as well. Be sure to remember to ask permission when you want to share information, to keep it respectful. Use facts, stick to evidence, but also keep it tailored to the concerns, and also don't overwhelm people with too much information at once. Make it digestible. They need to be able to understand what you're talking about and remember what you say. Make it easy and simple. Stories can be very persuasive. You can tell personal stories or stories that you've heard of others as well, but also remember to still be sensitive to cultural and family dynamics and people's own circumstances, and try and understand where they are coming from. Remember to be non-judgmental and non-confrontational, and respect other people's decisions. And again, do what you can to maintain trust, to keep the conversation going. It's very, very possible to both have confidence in vaccination yourself and to promote that among others, while still being open to discussing and listening to others, and encouraging them to learn more and to ask you further questions in the meantime. And so just on the next slide is just the last bit of references from where this information comes from. But those are just some considerations for how to communicate about vaccination, both for health workers, for non-health workers, in medical settings, and in communities, in families and individual settings. I encourage you to try these out, and good luck. This is important. So thank you all for your attention.
Thank you so much, Brett. I really appreciate the detailed way in which you presented the best way to approach vaccination. I have a few questions for you about it, but I'll save them for our Q&A session. But I do have a few questions, including, maybe you'll mull it over in the meantime, what is your #1 tip for how to do all of this excellent stuff in a short visit, the standard 10-minute visit, or a virtual visit? So I'll leave that in your hands, and then we'll get to the answer perhaps during the Q&A. So thank you again. And now we are going to be joined by Aurélie Devalle. Aurélie is assistant professor at the Department of Communication Studies, and she is a postdoctoral researcher at the Center for the Evaluation of Vaccination at the University of Antwerp. And she's going to tell us about how to tackle vaccine misinformation, something that's been really top of mind for many, particularly in the last few years. And with that, I'd like to give the floor to Aurélie.
Okay, thank you so much, and hello everyone. I will first quickly share my screen with you. Okay, there it goes. I hope you can see it now.
Yep, all good.
Okay, Good. So yeah, hello everyone. Today I will talk about how you can address vaccine hesitancy through communication. Now we have heard already in the previous talks about some great communication initiatives that are already out there, but my background is more an academic background, so I will focus on what has been done in research to give you an idea of some strategies that have been tested in research and have proven to be effective or promising. So what I will do first, I will focus on two strategies that can be used towards the general public. For example, used by the government or by public health authorities in public discussions towards the general public. And then second, I will also talk a bit about conversation strategies that healthcare providers can use when talking to patients about vaccination. But these strategies are also a bit applicable to any situation in which you have a private conversation with someone about vaccination. So that's what I will do today. So I will first start with these more general strategies that can be used to respond to vaccine misinformation in public. So in order to counteract misinformation about vaccination, we have two well-researched interventions that can be distinguished. And these two that I will talk about today are pre-bunking and debunking. Now, when misinformation about vaccination is expected, but people have not yet been exposed to it, then the strategy pre-bunking is recommended. This is actually a preventive intervention that takes place before people are exposed to misinformation. And this strategy tries to inoculate people against future exposure to misinformation. Now, on the other hand, when misinformation is already out there and people have been exposed to it already, then you can use debunking because this is an intervention that takes place after people have been exposed to misinformation. So on the timeline, you can see how pre-bunking and debunking relate to each other with regards to the time. Now I will go into a bit more detail on the first strategy, the pre-bunking strategy. So like I said, this is an intervention that you do before people are confronted with misinformation. The goal is to educate people about misleading techniques that are being used in misinformation so that people are armed to recognize misinformation in the future. So in that way, you are actually trying to prevent misinformation from having an impact. Now, when you want to apply pre-bunking, you actually have two elements to pre-bunking. First, you give an explicit warning of an impending threat of being misled. So you warn people that they might be misled. And then second, you educate people about misleading techniques that are being used in misinformation. Um, some frequently used misleading techniques that you can educate people about are often represented by the acronym FLIC, like you can see on the slide. Because of the time, I won't go into detail about all of these techniques, but you see here on the slide some examples of misleading techniques that are frequently used. For example, the use of fake experts, the use of logical fallacies, impossible expectations, the use of cherry picking data, and the use of conspiracy theories. So these are just some examples of misleading techniques. With pre-bunking, you warn people that they might be misled, and then you teach them about all these misleading techniques that are out there and could be used so that they can recognize them in the future. Now, if you want to experience an example of this pre-bunking technique, then I can recommend you to play a game. It's called the Bad News Game. You can just find it online if you Google it. And it's an interactive and fun game, actually, which is developed by scientists. And you get to play it for 15 or 20 minutes. And over the course of these minutes, you learn to apply the most common misinformation techniques, while at the same time actively generating your own antibodies against misinformation. So it's a nice game to see what pre-bunking is about, and also to educate yourself about misleading techniques. This is also an excellent example of how you can scale up a pre-bunking intervention and make it accessible to large audiences. So you can let them play a game, and in that way, you are applying this pre-bunking technique as a preventive measure to prevent people from being misled by misinformation in the future. The second technique that I want to discuss is debunking, like I've said before. So this is about correcting misinformation after people have been exposed to it by giving evidence-based counter-arguments. Now, research has shown that using 4 steps in debunking in a specific order is actually the best way to do this. So what are these 4 steps, or how should you debunk a myth or misinformation? First of all, it is best to begin your reaction with stating the facts. So begin with the truth, with facts that you know are evidence-based and true. Then warn the people that you will be repeating a myth or repeating misinformation, and then mention this myth or this misinformation only once. Then in the next step, you can explain how this myth or how this misinformation misleads. So explain which false reasoning has been used in the myth. And then, of course, finally end by repeating the facts so that you actually have a factual wrapper so that you start and end with the facts. So to make sure that that is what people will remember. This debunking technique can be used by all kinds of parties, for example, by the government or by public health authorities when they are providing fact checks, for example. But you could also use this technique yourself in a public discussion, for example, on social media. So my message here would be, if you see misinformation and you want to react, don't hesitate. Just take these steps into account, and you know that you are using an evidence-based way to react when you want to debunk a myth. So these pre-bunking and debunking strategies were strategies aimed at the general public and frequently used by, for example, governments or public health authorities for public discussions. But there are, of course, also communication strategies specifically for conversations between healthcare providers and their patients, or more in general for more private conversations. Why do I want to focus on this as well? Because we see that healthcare providers play an important role because they are seen as the most trusted source of information about vaccination by the public. So when healthcare providers engage with vaccine hesitant patients, they can actually use the guide that I have shown here on the slide. And for this, I have actually based myself on some excellent materials that WHO has used, which is why this actually reaffirms a bit what Brett Craig has just talked about before. But I will go through this guide because it gives an idea of how you can build a conversation with vaccine hesitant patients or even just vaccine hesitant acquaintances that you talk with. So a way to actually start a conversation with someone who has concerns and questions about vaccination is by starting the conversation with open-ended questions. This is to explore the main reasons behind the hesitancy. I have put some examples on the slide. For example, you could ask people, what is your greatest concern about this vaccine? Or could you tell me what you heard about this vaccine? And in this way, you invite them to open up about their concerns. Then in the second step, you can reflect and acknowledge the patient's concerns by repeating what the patient says or what you think the patient means. You could, for example, say, I understand that you want to make the best choice for your health, but you are worried about the side effects of this vaccine. So in this way, you reflect on what they have just told you. Or you could say, I understand that it can be confusing to know which information to listen to. Then in a third next step, it is good to recognize the strengths of the patient and provide encouragement to identify your common goals. So it is good to congratulate the person on the strengths that he or she has in their behavior. For example, if you have someone in front of you who has read a lot of information about vaccines, although it is not always the right information, you could say, I can see that you have done a lot of reading and thinking about this vaccine. So in this way, we really recognize their strengths in their behavior. Then in the next step, you could use the elicit, share knowledge and verify technique. So this means that you first of all want to elicit the knowledge of the patient. So you ask what the patient already knows about vaccines or the specific vaccine that he or she has questions about. And then you ask for their permission to share your knowledge to complete the knowledge that they already have. So that is the share knowledge part. And then when you have shared your expert knowledge, it is of course good to verify if they have understood what you have been saying. So that is the verify part. So if we give some examples of this, you could, for example, start by asking, what do you know about the side effects of this vaccine, to elicit the knowledge that they have. Then if they have told you what they already know, then you can ask, if you agree, I can share with you some information about the side effects, just to complete their knowledge and give your expert advice and knowledge. And then, of course, in the end, you can ask if this information has helped them to clarify the side effects that they were worried about. And then we've come to the final step. How can you end a conversation like this? When you want to end this, it is always good to summarize the whole interaction and also to indicate concrete action. So, for example, you could say, it sounds like your concerns were mainly about the side effects. Now that we have discussed the common ones, what do you think you want to do? So in that way, you just summarize the whole conversation. You show that you have listened to their concerns. You refer to the information that you have given, and you also link this to a specific action by asking what they want to do now. So the previous slide actually showed this step-by-step guide for building a conversation with a vaccine hesitant patient. But maybe the most important takeaway from all of this, and this also refers to what Brett Craig has said before, the most important takeaway here is that you show that you have empathy in your conversations with vaccine hesitant people. So whether you are a healthcare provider or just a person having a conversation with an acquaintance, I think showing empathy and listening to people with concerns is really key. So to end my talk, I have listed some more general conversation tips. These are mainly aimed at healthcare providers, but the same principles of empathy and listening can also be applied in private conversations. So if we dive into these tips, the first one would be to actively listen, to show interest in concern and concern. Try not to judge or minimize the concerns and questions of vaccine hesitant people. Always be respectful and avoid going into a debate or avoid arguing very strongly. And always respond with empathy and understanding. Now, showing empathy does not mean that you can't give your professional advice or your evidence-based facts. So, of course, it is still important to give your positive encouragement and give your strong recommendation for vaccination. So it doesn't mean that when you really listen to a person and show empathy for their concerns, this doesn't mean that you can give your strong recommendation. So these were the tips that I wanted to give you in a short nutshell, and I'm very happy to answer your questions later. Thank you.
Thank you so much, Aurélie. I really appreciate your expertise on vaccine disinformation, big growing issue. We are running a little bit short on time, and I do want to give Elizabeth her 10 minutes for her presentation. So we will take some questions in the remainder of the session's Q&A. So with that, I'd like to introduce Elizabeth Adams. She's joining us today. Elizabeth wears many hats. Among them, she is president of the European Federation of Nurse Associations, as well as co-chair of the Coalition for Vaccination. Elizabeth will be sharing with us some of the initiatives and tools that can help support health professionals in communicating about vaccination. I'm very sorry that we're running a little bit behind on schedule. Thank you for your patience. But yes, we'll have 10 minutes with you, and then we'll get to all of the questions that are already coming through the chat. But please do send us some more. Elizabeth, over to you.
Thank you very much, Sarah, and thank you so much for the warm welcome. And it's just wonderful to be part of this event. So I really do want to thank ECDC for the invitation for us to join. And really, I'm going to talk to you a little bit very quickly about the Coalition for Vaccination. And just as Katie did earlier, welcome everybody to the European Immunization Week, which we know it goes on all year round, but it's really good to have a focus, and commend all the previous speakers before. It shows you how complex and detailed the topic is, and without all of you and everybody working together, we would never get such positive outcomes as we do. So next slide, please. Just to say then, the Coalition for Vaccination, it was convened by the European Commission in 2019, and it was based on the 2018 Council recommendation. Now, Katie already mentioned this earlier on, that this is the political mandate, and more eloquently expressed that. But just to say that, you know, it was very much recognized that vaccine is considered to be one of the most effective public health tools in the prevention of infections, diseases. And we heard from the director of ECDC earlier on, Andrea, who really emphasized the importance of life course perspective, which was recognized. Now, this coalition was established, and great credit has to be given to the European Commission in relation, it was in advance of the pandemic. We had no knowledge of it at the time. And as Katie said, it was in relation to the upsurge in measles. So we were a little bit ahead of the wave, but that was due to the great work of DG Sancte and the European Commission, which we very much appreciate. Just to say, currently the coalition, it has 18 European associations of healthcare professionals, nurses, doctors, pharmacists, midwives, dentists, physiotherapists, and also very importantly, because we have to future-proof, we also include student and student associations, and we also have 9 associated organizations. It is co-chaired, as Sarah said earlier on, by the Standing Committee of the European Doctors, the European Federation of Nurses, of which I'm from, and the Pharmaceutical Group of European Union, who I am representing all 3 organizations as one of the co-chairs of the actual coalition. Next slide, please. And just to let you know that the coalition was convened to deliver accurate information, easier said than done, to the public, and to combat myths. And we know the many challenges around there, but also to exchange best practices. The coalition also organizes advocacy campaigns and publishes statements. Now, this is really important. It's a significant shift that all healthcare professionals are coming together to have one message, one agreed message, and really work towards this across the life course. We have participated in the European Immunization Week since 2020, and we also participate in expert meetings such as the EU Health Security Committee, the EU Presidency conferences. Also, we promote the excellent work of the ECDC, also WHO, and particularly the European Commission DG Sancte work. Next slide, please. So it is funded, we had support and funded. There was an Immunion project which started in April 21 and went to March 2023. So it's just finished. And just to let you a little bit insight in relation to this, really brought the foundations of the coalition together. The overall objective was to support the EU efforts to improve vaccine update by strengthening joint efforts among the coalition for vaccination members association and stakeholders in order to deliver vaccine education to health profession and better information to the public. And I have to commend Euro HealthNet, where the leading organization in relation to this project, and showed great leadership, initiative, and great creativity. And the specific objectives were dissemination of resources, strengthening the coalition for vaccination, increasing training programs, enhancing collaboration with media, and improving overall equity of vaccination. No mean feat. And there is a booklet that is a resource there that you can have a look at to see the excellent work that was done in relation to that. Next slide, please. So in relation to providing training opportunities to improve confidence in vaccination, we already heard Henri, and we also heard Brett as well in relation to some of the very important work in relation to communication. And I have to give great credit to the University of Antwerp under the Immunion project. They actually developed the Train the Trainer programs for many organizations throughout Europe. And just to flag that there is a curriculum, vaccines and vaccinations, and there's 8 modules, including the elaborate module on communication and vaccination. And we know ECDC also have programs, and the European Commission also have the portal, which is really important. Next slide, please. And then in relation to sharing resources to strengthen the education of knowledge, and this is strengthening education and knowledge on immunization. There is a platform. It is a joint initiative with the Vienna Vaccine Safety Initiative and the European Academy of Pediatrics and Immunion. The training materials for professionals such as adolescent immunization, vaccine safety, pharmacy-based vaccine administration. So very broad in relation to it, because it does go across the life course. And of course, just to flag that the website will be developed further in line with the EU-funded RiverU and Immunion projects. So it's ongoing work that's constantly being revolved. Next slide, please. We also have an online toolkit for communication and community engagement tools to increase vaccine update. And there are searchable databases. There's different languages, over 200 resources. And of course, again, it's an evolving process and it's ongoing updating and information. Next slide, please. And also part of the raising awareness and visibility of the Coalition for Vaccination. We have to thank Immunion for the wonderful work that they did on the Coalition brochure, which you can see in the middle of the screen, and many other messages, and the Coalition coming together to making statements. Next slide, please. And just an example of the work that the Coalition does of one of the statements that they made on vaccine and the leadership that we show in relation to bringing health professionals together. The Coalition had in this statement had reiterated that healthcare professionals should remind families whose children are behind on routine vaccinations, inform families when and how children are eligible for vaccines, for example, listen to discuss with hesitant people, clarifying information, debunking myths, and tracking disinformation. And we heard that from our previous speaker. Build trust, and I think Brett really emphasized the trust building, and other speakers, in vaccines by being transparent and up to date with scientific evidence, and support migrants and fragile populations. And of course, be aware that health professionals and colleagues are acting as role models, and therefore they have to be vaccinated according with their own national programs. Next slide, please. So the long-term impact on sustainability, of course, we did a very large study under the project. There was 3,298 health professionals that were surveyed, and it was found one of the biggest things was the lack of confidence in vaccine advocacy. And we have been working really hard towards bringing this material together to support health professionals so they have one source that they can go to for various sources of reliable information. And just to say as well that the Immunion project, the key recommendation, which was really important, that policy makers, health authorities are really to support health professionals to communicate with confidence and cultural confidence about vaccination. And I think we've seen that today with the presentations, particularly from ECDC and of course the University of Antwerp and of course DG Sancte and all the other presenters, the importance of communicating with confidence going forward. So that's a very brief overview on behalf of CPME, PGEU, and of course EFN in relation to the coalition. And I'll hand the floor back to Sarah. Thank you for your attention.
Thank you so much, Elizabeth. We really appreciate your expertise and presentation. We are now going to transition to the Q&A. So we'll have, we don't have too much time left. We have about 12, 15 minutes left. So I'm going to start with a sort of round robin, one question per panelist. And so I'm going to circle right back to you, Brett. So maybe you've had a bit of time to mull over the question. What is your top tip for how to communicate about vaccines when you're doing shorter visits or virtual visits, and does it risk backfiring if you do that in a shorter visit or a virtual visit?
No, it's a great question, and it's a question we often get, especially from health workers. They already feel like their time is very constrained talking to patients and caregivers. So a couple of really important things to remember. One is that no single conversation often takes someone who is very concerned or hesitant to accepting. And so that doesn't mean you can't have a very impactful, in fact, the research shows this with behavior change, that even a very short, concise conversation, but an effective conversation with a health worker can create a change, a lasting change in a patient's perception, attitude, acceptance of something, including vaccination. So again, it's not that they don't have time to do it. It's really that health workers don't not have time to take these important steps, because a patient, especially someone who they're going to see probably again, is going to perhaps become even more hesitant, more concerned, more distrustful if the conversation doesn't go in a positive direction either. And so it's important to remember it that way, that it's not going to stay the same, but likely you're going to either move someone closer to acceptance or maybe push them closer towards refusal. So take the little time that you have and try to address, and even maybe asking the question like, what is your main concern about not vaccinating today? And you can be upfront with the amount of time that you have. We only have a few minutes today. Why don't you tell me, share with me, what is your main concern? And we can at least talk a little bit about that today. And then it's about directing them to resources, other sources of information, scheduling another appointment. Some primary healthcare facilities we've worked with in some countries have thought about dedicating some resources in their primary health centers where they do counseling on behavior change for some lifestyle changes, such as alcohol, tobacco, nutrition, diet, etc., but also integrating some resources and having some people prepared to discuss vaccination with concerned caregivers there, so that the GPs can continue to meet with their patients regularly, but can refer them to somewhere where someone can have a longer conversation to address these questions. So just some ideas. It's definitely always a concern, but there's definitely some tips of how to do it effectively, and it's really important. You can't neglect it. In fact, it can make things worse if you don't try and maximize that time. Good communication doesn't have to take more time just because you're effective with the conversation with others.
Yeah, so it sounds like it's inching towards an understanding of the person's concerns. One visit after another doesn't all have to be revolutionary in one visit.
It can be, yes.
No, it can't be. My next question is for Aurélie. I've heard of vaccine hesitancy clinics where people who have questions or skepticism or concern about vaccines can go and speak with experts who can sort of help them debunk this information that they have. Maybe they didn't get some pre-bunking done, but at least there's some debunking that can happen. And I'm just wondering what you think of that concept and whether there's scope for more clinics along those lines in Europe. I've only ever heard of them in North America, but I'm wondering if you think there's room for them in Europe and if they already exist even.
Yeah, well, yeah, good question. An interesting concept indeed. I'm not sure, but I've not heard about this in Europe, so I'm not sure if it exists, but if it does, I haven't heard about it yet. But I think this could be an excellent idea, and I think this also links a bit to what Brett just said before, and your question to him. We see that healthcare providers often have don't have much time to address all questions and start a whole conversation. So I think this could be a great idea to address this. So yeah, I think that could be a great solution. And I think for this concept to work, it should be really key that those people tailor the information that they give to the specific concerns of the people in front of them. Because of course, if you have more general campaigns, you can just give general information, but it's very difficult to tailor it to specific groups of people or even specific individuals. But I think the concept that you are talking about could be very good, specifically in tailoring the information to the individual, to make sure that the information the individual gets can have a big impact because it is so tailored to the specific issues that they are facing.
Yeah, thank you. I'd like to move on to Elizabeth now. We have a question from the chat from Jasminka. I apologize if I'm not pronouncing your name correctly. I'll do my best. Jasminka Vugek Mihok. And the question reads, given the efforts to increase accessibility to lifelong vaccination, what is the role of pharmacists? In the COVID pandemic, pharmacists have proven to be a valuable resource. Is there consideration at the European level to expand their role in not only COVID vaccination, but also lifelong vaccination, including routine immunizations?
Thank you, Sarah, and thanks for the wonderful question. And yes, every single health professional is really valuable, and I think we should be using people's, education and their expertise, and particularly pharmacists, really play an important role in relation to medicinal products and prescribing and all of those. And we really have to benefit that. Many countries over the pandemic realized the real value of our pharmacists and to be able to deliver vaccines, in many rural and remote areas as well as in urban areas. So there was a lot of underutilization of many health professionals, and I think it's really positive that we're looking at broadening that. And many countries are doing that, even though, if it's not pan-European at the moment, but it's certainly the way that we're going forward to use everyone's skills to the greatest potential.
Thank you very much. Follow-up question to you, Elizabeth. We often talk about vaccine hesitancy when it's in the general public, but it is true that there are some healthcare providers who express skepticism or hesitancy about vaccines as well, and even though they may be a minority. And how can the healthcare providers inform patients if a certain proportion of them don't support vaccines? This is a question that came in through our chat.
Yeah, I think, yes, it's a very small minority, and overall, from my experience anyway, nearly all health professionals that I meet are very positive, but there may be hesitancy with them if they don't have. We can't assume that somebody who may be hesitant, they may not just have the information to hand, they may not feel as confident. So our role is really to ensure that, that health professionals are really confident. And I think Brett pointed out very early on, and we have to be very honest, and we have to be open, and we have to say, okay, this is the information that we have, and I will come back to you and, inform you of further information. I think it's about giving health professionals who feel as though they have to know everything about everything, the actual space too, so that they get. So it's as Brett said, it's that first step of that positive interaction. They trust usually the health professionals. It's to maintain that trust and to give that information and then find out that information for the person. So yes, there's hesitancy, but it goes on a range of maybe people that maybe don't have the information and need to be assisted to get the information. And the same tools that were presented previous by Oriel and by Brett that was applied to, the public should be applied to health professionals and one another, the communication skills and all of that. And I think that will bring everybody together on the one page.
Thank you. Brett, I've just got one last quick question for you. How can healthcare providers communicate risk? We talk about risk of a disease, we talk about risk from a rare side effect, but how can healthcare providers communicate that in a way that doesn't feel overwhelming?
No, it's a great question, and it's actually really important for vaccination conversations. One important thing is that we find people increasingly want to actually know statistics at a local level. They want to know, okay, what is the disease prevalence in my country, in my communities, and what is the safety evidence around vaccine use in my country? We tend to think that the more data we can show, globally, X amount of vaccines have been used, et cetera, X amount of lives have been saved. That is great to have, but people who have concerns, maybe some distrust issues, they want to know, what's it like around me? And are people like me going to be safe getting this vaccine? And are people like me going to be protected against these diseases you're talking about, or me or my children, for example? And so health workers can be really effective if they use local data as well. Say that these are the vaccines we've been using for how long. I've vaccinated this many people. We don't have any of these severe side effects. We've only had some of these very common side effects, which are very mild and they're okay. Bring that risk information to a accessible local level, and that's really impactful with people who have concerns. And then secondly, again, as I mentioned, make sure you talk about all three aspects of the risk and benefit conversation. So it's risks of the disease itself, and again, local information is really good. If measles is not spreading locally, that's good news, but explain how the risks of not vaccinating can increase those risks of infection, right? So risks of
bringing it local is
bringing
really
it local again, absolutely.
Okay.
And even saying that there aren't outbreaks right now here, but we know of outbreaks in neighboring countries. They could come here if we're not vaccinating regularly, etc. So risks of infection, benefits of vaccination, but then also, again, we have to be open about the risks of vaccination as well. Help people with very clear, plain language to understand that that even with risks of vaccination that are known, we don't need to be so concerned about the hypothetical or unknown risks of vaccination. We know what the risks are. They've been in use. They've been studied very closely. They've been reported very well. We know what those risks are. We know how small they are. And even more important than that, health workers need to remind patients and caregivers that even with these risks in vaccination, there's mitigation measures in place, that we can even lessen those risks, that if something were to happen, if there is allergic reaction, we know what to do. We have people trained and ready. So that, again, that reassurance that even with the known risks, you're not on your own. We're still going to be able to do something about it.
Thank you so much for it. Yeah.
Exactly. Yeah. Having that conversation, remembering to include these different elements is very important.
Thank you very much. I've got one final question before I wrap up because I'm looking at the clock ticking. Aurélie, as an expert on vaccine disinformation, do you think that social media platforms are held sufficiently accountable for the role they may or may not play in the circulation of vaccine misinformation?
Yeah, good question, because indeed we have heard before that actually there's pros and cons of these social media platforms, because they can do a lot to fight misinformation, but of course these are the platforms where misinformation is actually spread. So yeah, I must say I'm not really an expert on what they are doing or have been doing, so I don't want to make too bold statements here. But I think we should keep on encouraging these platforms to do what they can, because they can do a lot to fight misinformation. They have tools available. They can do a lot. So I think our role should be to keep encouraging them to do this, because they have an important role to play there. So that's what I would say about this.
Thank you very much. This brings our Q&A to a close. I want to thank each of our speakers from both halves of the event for their time, their expertise, and their engagement. And I really also want to thank each of you in the audience for being tuned in and for sending us such fantastic questions. I think it's pretty clear our panelists have said that vaccines are important across our full lifespan. We often talk about routine immunizations in childhood, but really vaccination has a big role to play across our lives. And our panelists have also made it clear how crucial it is to effectively communicate about them, to pre-bunk, as Aurélie taught me, and to debunk vaccine misinformation. We've also heard how important it is for the general population, but especially to find ways to communicate with communities where we need to bridge gaps in vaccination coverage. So this concludes our event marking the start of European Immunization Week, but we'd really love it if you could join us on May 17th from 1 p.m. to 2:30 p.m. CEST for an online event on HIV, hepatitis B and C, and sexually transmitted infections, looking at why testing is important and what can be done to increase testing access and uptake. And this event will be on the occasion of Spring European Testing Week, and we'd really love it if you could join and register on the ECDC website starting next week. And with that said, thank you all so much for your time, for your attention, and we'll see you soon. Have a great day.
Thank you.